Good afternoon. My name is Paulo Villus. I talk about gastric pediatric Menestriers disease. Definition: also known as hyperproteinemic hyperprotein gastrophy, is a rare acquired premalignant disease of stomach characterized by massive gastric fouls, excessive mucus production, and protein loss. Presentation video.
Hey guys, and welcome to How to Gastro. In today's presentation, we will be talking about Menetrier disease. So let's get started. So what is Menetrier disease? Menetrier disease is an acquired but rare disease which involves the gastric folds or the gastric rugae of the stomach. In a normal stomach, mucous cells in the rugae release a protein called transforming growth factor alpha or TGF-A. But in Menetrier disease, the mucous cells in the enlarged rugae release too much mucus, which in turn cause proteins to leak from the blood into the stomach. This shortage of protein in the blood is called hyperproteinemia. Menetrier disease also reduces the number of acid-producing cells, which are called parietal cells, in the stomach, which decreases the amount of acid which is usually produced by the stomach. So Menetrier disease, we have these enlarged rugae. We also have the mucous cells, which are very large in number, and large cells, which are found in these large rugae, these abnormal rugae. And usually these rugae in the stomach release a growth factor called TGF-alpha. But in Menetrier disease, because these rugae are so enlarged, they release too much TGF-alpha, and in turn we have too much production of mucous cells and therefore too much production of mucus. And we also have the loss. So those are the three main criteria in Menetrier disease.
Continue presentation video 2. Application in nursing: increased signaling of the epidermal growth factor receptor has been implicated in the pathogenesis of Menetrier disease. Monoclonal antibody against epidermal growth factor receptor. Presentation video 3.
Gastroesophageal reflux in children is a condition in which liquid flows backward or refluxes out of the stomach and into the esophagus. The esophagus is a muscular tube that connects the mouth to the stomach. It passes through a muscle called the diaphragm, which separates the chest from the abdomen. The passageway through the diaphragm is a hole called the esophageal hiatus. The wall of the esophagus has slightly thickened muscle layers where it connects to the stomach. These muscle layers, combined with part of the diaphragm, sphincter may relax even when the child hasn't swallowed, allowing food already in the stomach to move back into the esophagus. This condition is called to the esophagus. Stomach acid mixed with the food can cause irritation. If the food refluxes all the way up the esophagus, into the throat, and down into the procedure, the child will be given general anesthesia in the procedure for a camera and surgical instruments. Next, the surgeon will carefully find the lower esophageal stomach will be wrapped around the outside of the sphincter. The wrapped fundus will be sutured back onto the stomach to create a valve, which tightens, insert a feeding tube, also known as a gastrostomy tube, into the child's stomach while the sphincter. After the procedure, the child will be taken to the recovery room for monitoring. Pain medication will be given. The child may continue to receive antibiotics through the IV. Within 1 to 3 days, the child will be released from
was placed periumbilically, lower than typical for foregut surgery, to accommodate the massive stomach. Intraoperative endoscopy was challenging due to hypertrophic polypoid rugae and thick mucus secretions. The weight of the thick gastric wall prevented effective insufflation. Mobilization of the stomach began at the greater curvature with a stapler was created bluntly. A 60 mm stapler with double-loaded 5 mm trocar wound was extended to 6 centimeters, and a wound protector was placed to extract the specimen, which occupied much of the intraperitoneal space. With some effort, the specimen was extracted successfully. With the specimen open, the transition of mucosal hypertrophy and polyps was notable in the proximal stomach. With improved working space, we prepared for the Roux-en-Y by splitting the transverse colon omentum. The jejunum was divided at 50 centimeters distal to the ligament of Treitz.
Pros and cons. Pros of treatment shows great result reducing symptoms as well as the hypertrophy. Cons treatment, way too expensive for everyone. It is still being developed. Cons about this: nausea and frequent vomiting, diarrhea, loss of appetite, weight loss, malnutrition, hypoproteinemia, edema, anemia. Video 5.
Malnutrition is defined as an imbalance in the diet which leads to one or more diseases. However, the term imbalance can refer to either an excess of a nutrient or a deficiency of an essential nutrient. Connecting back to the Chemistry of Life unit, recall that proteins are made of amino acids, the structure of which is shown here. In A1.3, we discussed the difference between essential and non-essential amino acids. The term deficiency describes a situation where a particular nutrient is lacking, and this causes health problems. Where protein deficiency is concerned, it means that a person is lacking one or more essential amino acids, those that cannot be synthesized by the body. This protein deficiency malnutrition results in a disease known as kwashiorkor. The consequences for a person suffering from protein deficiency malnutrition or kwashiorkor are insufficient production of blood plasma proteins that can lead to tissue fluid retention and subsequent swelling of the abdomen known as edema. If it's a child who's suffering, stunted growth may occur, and there may also be an impairment of their mental and physical development. In addition, thinning hair may also be evident, and the person might show
Issue in Ecuador. In Ecuador, the incidence of this disease can be considered much higher as the rest of the world in people with 55 years or more. The healthcare ministry issued the acquisition of multiple diagnosing and treatment instruments for gastric disease among all the others. Conclusion: Menestriers disease is very common amongst Ecuadorians, especially in old people and in children below 5 years. as the disease is caused by a virus. Children's campaigns of vaccination and hygiene are necessary to avoid its complications. Thank you for your attention.